Welcome to our live online pharmacy show. Today, we're focusing on eye and ear health medication. Understanding pharmacology related to this treatment is essential to provide you with valuable insight into how these medication work, the condition they treat, potential interaction side effects, and important nursing considerations. If you have any questions about your eye or ear health, call us now. So, we have now a caller. Let's start with our first caller. Hello po, ma'am. You're on the air. How can I help you with today?
Hi, I've been experiencing a lot of pressure in my eyes. What do you recommend?
Yes po, ma'am. Okay po. For managing eye pressure po, I recommend Timolol. This medication belongs to a class of drugs known as beta-adrenergic blockers. Ang ginagawa po nito is it works at the molecular level by decreasing the production of aqueous humor in the eye, which helps lower the intraocular pressure po.
Now let us see how this drug acts. Timolol acts on the adrenergic neurons which are supplying to the eye, which are equipped with norepinephrine mediator. So on the postsynaptic adrenergic neurons, beta-2 receptors are present. When this norepinephrine is released, it can act on the beta-2 receptors, resulting in the activation of postsynaptic neurons. These neurons are supplying to the eye where they can produce the aqueous humor, which is responsible for lubrication of the eye. But in the patients with glaucoma, this aqueous humor is more produced or it less clear, which results in the increased intraocular pressure within the anterior chamber of the eye. In such situations, Timolol maleate can be used. It can block the beta-2 receptors present on the adrenergic neurons, thereby it can inhibit the postsynaptic activity, which results in the decreased formation of aqueous humor. Thereby it can reduce intraocular pressure. In this way, Timolol maleate can be used in the treatment of glaucoma, and as this drug is going to block beta-1 receptors, which reduce the heart rate and cardiac output, that leads to decrease in the blood pressure. So Timolol maleate can also be used in the treatment of ocular hypertension.
Timolol is primarily used to treat conditions like open-angle glaucoma and ocular hypertension. For instance, if someone has diagnosed with glaucoma, Timolol can prevent vision loss by controlling eye pressure. However, be cautious of drug interactions. For example, combining Timolol with other systemic beta blockers can enhance bradycardia risk. Common side effects includes burning or stinging upon application and blurred vision. Serious side effects may include respiratory issues or worsening heart failure in susceptible individuals. In-nursing considerations are vital when administering Timolol. It's essential to monitor the heart rate and blood pressure regularly and educate patients on proper drop instillation techniques to avoid contamination.
Now let us see the precautions of this drug. One of the important precautions is that Timolol maleate is a non-selective beta blocker. So it can act on the other smooth muscles where beta-2 receptors are located. So this drug can block the beta-2 receptors located on the bronchial smooth muscle, resulting in the bronchospasm. So this drug should be carefully given in the patients with any bronchospasm, and in the patients with asthma or COPD, this drug is contraindicated. Similarly, this drug can increase the muscle weakness in the patients, which may result in the double vision, diplopia, and some fatigue can be observed. So this drug should be carefully given, and this may also increase the symptoms of myasthenia gravis. So if patient is already having any muscle weakness, then this drug should be carefully used. Similarly, Timolol maleate can increase the allergic response. As this drug is going to increase the histamine release from the mast cells, the allergic response can be increased by Timolol, and this drug can also reduce the cerebral blood flow. Finally, this drug may mask the hypoglycemia produced in the diabetic patients who are taking insulin or anti-diabetic agents. So in such patients, Timolol maleate should be carefully used. What are the side effects? The side effects of Timolol maleate are mainly the local reactions. It can produce some burning sensation, stinging, and it can also produce some blurred vision, headache, hypotension. It can produce some allergy resulting in itching. Decreased visual acuity can be observed with this Timolol maleate. and it can also increase the risk of formation of cataracts. Finally, it can produce some insomnia, lack of sleep, and muscle weakness can be produced by this drug.
Next caller, your life. What's your concern?
Hello, I've heard about latanoprost for eye issues. Can you tell me more?
Absolutely. Latanoprost is a prostaglandin analog that enhances the outflow of aqueous humor through uveoscleral pathway. It is used to treat primary open-angle glaucoma and other hypertension as well. For example, patients who cannot tolerate other medication often find latanoprost effective. Be aware of interactions. For instance, latanoprost with thiomersal-containing products can lead to precipitation issues. Common side effects include eye redness and increased pigmentation of the iris. Serious side effects are rare but can include severe allergic reactions. Nursing considerations include instructing patients on correct administration techniques and monitoring for any signs of irritation or allergic reactions.
Hello, Mom? Yes, you're online.
Hello? I think I have eye infection. What should I use?
So for bacterial infections, tobramycin and aminoglycosides antibiotic is highly effective and it works by binding into the bacterial ribosomes and inhibiting protein synthesis. So this medication treats conditions like conjunctivitis and keratitis. If someone has a infection or bacterial infections in their eyes, tobramycin can clear it up quickly. However, be cautious with interactions combining tobramycin with other antibiotics. Common side effects includes eye irritation and burning sensation, while for the serious reaction may result from allergic responses. When administering tobramycin, make sure that the patient knows the proper drop application technique to prevent the continuation of the infection. Also, make sure to monitor for any signs of superinfection.
Now, let's switch gears to ear health. Next caller, what's your health question?
Hi, my child has swimmer's ear. What should I give them?
For that condition, acetic acid solution, which has antibactericidal and antifungal properties, is great for treating external otitis. It disrupts bactericidal cell walls to combat infection effectively. This solution is particularly useful for swimmers' ears by moisture in the ear canal. Avoid using it with other otic medication unless advised by a healthcare provider due to potential interactions. Common side effects include temporary stinging or burning sensation in the ear canal. Nursing considerations, including advising parents on proper administration of techniques and monitoring for signs of local irritation or allergic reactions.
Next caller, what's your question?
Hello? I have a lot of earwax built up. What should I use?
So carbamide peroxide otic solution is perfect for softening and removing earwax safely. It releases oxygen when placed in the ears, causing the earwax to bubble and soften. This helps facilitate its removal without irritation. Just follow the instructions carefully.
To use Otex eardrops effectively, tilt your head, then squeeze up to 5 drops into the ear. Leave for a few minutes, then wipe away any surplus with a tissue. Repeat once or twice daily until symptoms clear. Treatment usually takes about 3 to 4 days.
For the side effect, we have ear irritation, temporary ear discomfort or fullness, allergic reaction such as swelling or rash. Contraindication, active ear infection, especially if eardrum is perforated, hypersensitivity to carbamide peroxide or any component of the formulation. Nursing considerations such as advise patient to follow proper instruction for administering eardrops, ensure the ear is not infected or inflamed before recommending carbamide peroxide, recommend the patient remain in the appropriate position to allow the drops to stay in the ear canal for the prescribed duration, and monitor for signs of irritation or allergic reactions.
Let's take one more caller. You're live.
Hello? Hi, so I have a problem. I have an ear infection with inflammation. What should I do? What drug should I take?
Combination of antibiotics and corticosteroids. Dexamethasone. These are excellent for treating acute otitis externa while reducing inflammation. Ciprofloxacin works by inhibiting bacterial DNA replication, while dexamethasone reduces inflammation in the ear canal. For patient education, instruct on proper eardrop administration, lie with affected ear up, administer drops, and remain in position for 1 to 2 minutes. Avoid inserting objects in the ear to prevent further irritation or damage. Ciprofloxacin, dexamethasone ear medication have the adverse effect of local irritation, itching, or redness of the ear canal. Possible systemic absorption leading to corticosteroid-related effects such as increased blood sugar and fluid retention. For nursing consideration, clean the ear canal before applying drops. Ensure the patient is sitting upright when administering drops, and do not administer to patient with a perforated tympanic membrane unless directed by a physician.
Ciprofloxacin is a second-generation fluoroquinolone antibiotic, which is used to treat a wide range of gram-negative and gram-positive bacterial infections. It works by inhibiting bacterial DNA synthesis and thereby preventing their replication. More specifically, ciprofloxacin binds to the bacterial enzymes DNA topoisomerase 1 and 2, which are essentially required for the strict regulation of DNA replication. When these enzymes are occupied by ciprofloxacin, they are no longer able to perform their functions, resulting in synthesis of abnormal DNA molecules and termination of DNA replication. Ciprofloxacin can be administered to the body through several routes, and the commonest route is oral. Oral tablet, oral suspension, and intravenous preparation are indicated for the treatment of following conditions: bacterial skin infections, bone and joint infections, complicated intra-abdominal infections, nosocomial pneumonia, chronic bacterial prostatitis, lower respiratory tract infections such as acute exacerbations of chronic bronchitis, complicated urinary tract infections, and acute sinusitis. Otic solution and suspension can be used to treat acute otitis media and externa. Ciprofloxacin eye drop can be used to treat bacterial corneal ulcers and conjunctivitis. Ciprofloxacin is metabolized by the liver and excreted via kidneys. Ciprofloxacin is usually a well-tolerated drug. Minor side effects include nausea and vomiting, diarrhea, headache, rash, and restlessness. Rarely, individuals can have acidosis, allergic reactions, loss of appetite, blurred vision, and bad taste.
Thank you all for calling in today. Remember, when it's for your eyes or ears, understanding this medication can significantly enhance your health outcomes. Visit our online pharmacy to order this medication safely and conveniently. Your health is our priority.